Okay, we'd like to go ahead and begin. So hello everybody and welcome to today's AACH webinar on Train the Trainer Programs, Developing Internal Facilitators of Relationship-Centered Communication. I'd like to thank everybody for joining. This webinar is hosted by the American Academy on Communication and Healthcare. My name is Rachel Porch, and I'm the project coordinator here at the Academy, which is a nationally based nonprofit organization. Many of you may have joined us today because you're members, and we're happy to have you with us. Our live webinars are currently free and open to everyone, members and guests. However, our recordings are reserved for our AACH members. So with that, if you are not an AACH member and would like to benefit from these recorded webinars, as well as many other very valuable benefits, we would like to invite you to join our community. Feel free to visit our website for more information through the link there on the screen. AACH hosts annual events, so we'd like to invite you to mark your calendars for these upcoming programs. First, the Enrich program will be held on June 8th through the 11th in Los Angeles, California. This course has a very interactive skills-based approach to learning and developing communication skills, and also to foster those skills to take back to your institution to grow and to teach others. And then we have the International Conference on Communication and Healthcare and Health Literacy Annual Research Conference, which will be held on October 8th through the 11th. And this is geared towards those who are working in academic and research fields of clinical medicine and academic communication, who are studying topics across an array of communication and healthcare areas. We are now accepting abstract presentations for this conference, and the submission deadline is March 27th, and you can access those websites there through those linked titles. So as we segue into our actual presentation, I would first like to practice using the chat box on the bottom right of the screen. Since our participants don't have a vocal voice, this is where we would like to invite your questions and comments. So please feel free to type in your answers to the question there on the screen. What is your professional role or title? Great. Great. Looks like everybody's able to type in the chat there. Thank you, everybody, for participating. And just a reminder, if you have any questions throughout the presentation, please feel free to type those in the chat box there, and we will work to address them as soon as possible. Okay, moving forward, I'm very pleased to begin my handover here to Dr. Chow and Dr. Cooley with a short introduction. Dr. Chow is the American Academy on Communication Healthcare's Vice President of External Education, Professor of Clinical Medicine at UCSF, and Staff Physician at the VA Medical Center in San Francisco. As a faculty member of AACH, he is nationally recognized for his efforts in education and research to enhance communication between patients and physicians. And Dr. Laura Cooley is the Director of Education and Outreach for the American Academy on Communication and Healthcare. She leads efforts for outreach and development to support AACH's mission by collaborating with institutions to develop and deliver customized communication skills training programs. So thank you both for joining us today, and at this time I would like to hand our presentation over to you.
Delighted to be here with all of you today on this webinar, and hoping that by the end of the session that we have today, you'll have a little more of a sense of what it takes to start a Train the Trainer program in communication at an institution, what those train-the-trainer programs look like and how to sustain them. Here's a roadmap for where we're going to go. We'll first start with a brief review of the benefits of communication skills training and of communication skills in general. And then we'll segue into talking about train-the-trainer programs, the actual nuts and bolts of how to prepare for them, how to get them started, what the individual components of the train-the-trainer programs are, and then once the program is over, how to sustain afterwards. So communication matters for patient care. I hope it's not news to all of you on this webinar that in order to really provide great patient care to our patients, that communication is an important aspect of it. The reason that that aspirin is sitting there staring us at the face is that there was a recent review article which showed that a high-quality relationship between a patient and their provider accords the same salutary benefit as an aspirin daily to prevent heart attack for 5 years. So if you believe in aspirin, you also should believe in communication. It also turns out that patient outcomes are enhanced by enhanced communication. Patients whose providers are more empathic have better control of their diabetes. Their hemoglobin A1C, glycosylated hemoglobin scores are actually lower. Pain management is better in patients who have better communication with their providers. Adherence to medications is better. Patients like their care experiences better. They trust their providers more. And what is not on this slide is a whole bunch of other data that I've recently reviewed. Decreased suffering from cancer and at the end of life, enhanced cardiac outcomes in terms of readmissions for heart failure, reduction of 10-year risk of coronary heart disease, better care for patients who have medically unexplained physical symptoms, surgical outcomes are better, and also costs are better. Costs are reduced for patients who have better communication with their providers. So there's a lot of data out there that support the fact that effective patient-provider communication leads to better outcomes.
Thanks, Calvin. Yeah, I'm glad that you're reviewing some evidence, and I'm going to continue and talk a little bit about why this matters for providers, because we like to start with the outcomes for patients, and we also know that research shows that the job satisfaction and experience of providers who are delivering care actually improves when communication skills improve. So we see greater reports around engagement, reductions in turnover among physicians and staff across the board. Malpractice suits go down, and there's quite a bit of research around this, and obviously there are some serious cost implications connected to that, and of course patient experience reports. There is a growing body of evidence around how patient experience can be improved by improving fundamental communication skills. And this is a study that was published a couple of years ago at the University of Chicago, Newark Center. And I thought this was very interesting because this was a survey nationwide conducted among patient populations. And what most of us believe in healthcare is that the most important thing might be accurate diagnosis or competence, and that was important, and you can see that at the very top of this scale. But listening and being attentive and caring and things like bedside manner and relationship actually accumulated in this survey to 59% of the focus of what patients reported. It really directly goes back to relationship and personality. And there's also a growing body of evidence from institutions that we at AACH have worked with, as well as others, that show that we can see improved evidence around more courtesy, listening, overall quality of care. Reports show that there will be decreases in patient complaints, improved satisfaction for patients and staff, as mentioned, and even a few recent reports around provider burnout. And just as we segue in a moment to talk about train-the-trainer programs and how this links back, I can share with you the citations that you're seeing on the screen are a sampling of several articles, but most particularly ACH had the opportunity to help with the early development of communication programs with the Mayo Clinic systems at all 3 sites. And there was an article by Kennedy et al. In the Patient Experience Journal in 2014 that talked about their outcomes and how they were able to identify improvements in 13 of their Press-Ganey patient experience survey measurements. And we've seen similar reports at other Mayo Clinic sites. And our partners at the Cleveland Clinic Foundation have developed a very robust program, starting with some work from the ACH and then segueing to develop their own very successful institute internally and a cadre of trainers that they have trained as well. And they've published an article in 2016 that you might want to review that shows further evidence around this work. So we're very excited to talk about some ways that your institutions might be able to develop programs to reach these same levels of positive outcomes. So I'm going to hand back over to Calvin now and let him check in with the next part of our program.
So we're back to the roadmap right now. That was about if that was probably the fastest treatment of a lot of evidence that you may have heard in quite some time. We have a bibliography and references that are available on the website if you wanted to really dig into some of this data more. We will now move to the focus of today's program, which is about train-the-trainer programs, and starting with some nuts and bolts. But before we start with those nuts and bolts, we have a couple of questions that we'd like to hear your experiences with. There's a couple of questions here to ask. Let me see if I can get, there we go. So has your institution done a train-the-trainer program for any topic before? You can vote on the slide there. Any program, so that includes Lean Six Sigma and team steps and all kinds of stuff that you may have had train-the-trainer program experience for before. Great. So it's looking like approximately 2/3, 1/3 of the people who are voting at this point anyway, about 40-20. Okay, great, thank you. We'll go to the next question, which is, have you heard of train-the-trainer programs for communication skills, specifically for communication skills in healthcare before? Have you just heard of any? I guess if you've been listening to the webinar, you may say that is yes. But before the webinar, have you heard of it? Any? Okay. So most of you have heard. So it looks like about 80%, maybe slightly more than that, 83% saying yes, and some of you saying no. So thank you for answering that question as well. So we're hoping that by the end of today, you'll be able to get a sense of what train-the-trainer programs in communication skills might look like. Oh, right. Sorry, there was one more survey question that I forgot about. Sorry. So here we go. You rate strongly agree, neutral, disagree, or strongly disagree. It is viable for my institution to do a train-the-trainer program for communication and healthcare skills. Your initial thought. Okay. It's a very, very optimistic crowd. I can see. So thank you for those. So we have mostly strongly agree, and a couple of neutrals. Okay. Yes, and a couple of the comments saying that it's only about questions about viability and sustainability, which we will then go into in a bit. Great. Okay. Thank you for your responses. We'll have a couple of other questions later on in the webinar. Okay, moving on to train the trainer programs and communication skills, and I think Laura, you're on this. Is that right?
I certainly can be. So the train the trainer programs and communication skills may relate to some of the ones that you're familiar with in other programs. Some real advantages that we've noticed in our work with many institutions is there's an internal cultural understanding on the way that this organization works. We have an opportunity to develop champions of this work, the people who become facilitators or trainers within the institution have some advancement opportunities in many cases, and some ways to develop professionally. And what we find is that this can be a more effective approach to culture change if it's viable for your system, because having internal people rather than bringing in outside people can really lower costs in the long run and create a more sustainable future, because you have local people who carry this work forward and can connect with peers and really help to ensure that this is something that goes beyond a one-time workshop opportunity and can manifest into other areas. And what we're going to talk about next is really the 5 phases of train-the-trainer programs. So we'll walk through each of these phases. First, we'll talk a bit about preparing and selecting trainers. The second phase is really participating in the fundamental workshop. The third is understanding workshop design, how the program works. And the fourth is mastering the workshop delivery. And then finally, we'll talk about ensuring viability and sustainability. So in phase 1, many of you may have been in this phase or are currently in this phase. You really have to make the case. And in many ways, it's like building a business plan and ensuring that you have the evidence that is necessary to achieve buy-in. There obviously are financial and time implications related to embarking on any communication skills program, especially when you develop your own internal process. And there will be some additional human resources needed, so admin help. And in our work with institutions who do this, we now provide a lot of support to help think about the strategy as you prepare, because it's a lot more than just getting a slide deck. And finally, there's an important facet of selecting trainers. We often compare the difference between bringing in external experts versus creating your own internal experts, so to speak, those future trainers who will help to carry this work forward. And we have several qualities that we recommend that people look for. And as I hand over in this next slide to Calvin, I'll let him talk a bit about that if he'd like, and then take us into phase 2.
Great. I am going to go back to phase 1 for just a moment before we do that, and that is to also delineate the fact that to do a train-the-trainer program, you need to have people doing the training. Sometimes those people doing the training are local experts who, by having had lots of training before or training through ACH or Cleveland Clinic or some other kind of train-the-trainer program, that they have the skills to be able to bring a program to your home institution. So that external experts piece, you need to have people to do the training. And then the second component in the recipe is to choose folks within your institution who are ready, willing, maybe slightly skeptical, but not too much so, to undergo the training that we will be talking about in a moment, so that they will become internal champions of this work. Our experiences at the institutions where we've done train-the-trainer programs before is that these folks, they span many different parts of healthcare institutions. So we've had many physicians be trained. We've had lots of advanced practice providers trained. We've had some standardized patient coordinators, educators, many different kinds of folks trained in these programs. What enables them to rise to the top in these programs is not just the enthusiasm and the skills, but also the fact that these communication skills provide them a very important base to become leaders in institutions. So doing this train-the-trainer program can really launch the careers of many budding folks who are interested in patient experience, communication, just in general healthcare leadership. So that's the first phase. Before you ever get there, we don't mean to presume or assume that only Boy Scouts can become trained trainers. This is just the be prepared part that we want to emphasize. We've had many folks of all walks of life. So moving on to phase 2 then, and that is to participate in a fundamental skills workshop. There is a lot of data to suggest that when you're learning communication skills, it's not the same as understanding a concept. In order to really grasp the skills, it requires practice and feedback. Using adult learning principles, which is more of an experiential kind of experience rather than a passive experience like you're undergoing right now, where you're just listening to Laura and me talk. In the workshops that we put on, we try to decrease the amount of time that we spend in didactics. We show a demonstration of the skill that we've just talked about, and spend the bulk of our time in skills practice. What we've outlined here is the use of role play. That is one of the very important modalities where providers have the opportunity not only to practice the skills, the communication skills that they are learning, but also the opportunity to sit in the patient's chair so that they can see what it feels like on the other side and be able to give feedback to people who are practicing the skills about what it feels like. We feel that that's a very important duality for providers to experience. And then after we go through the fundamental communication skills that we teach, we make certain that we are applying these skills to everyday challenges that providers have.
And Calvin, I'd like to check in for a moment and say thank you to those who are typing in the chat box. I see a note from Casey, who is representing the Society of Participatory Medicine. And one of the reasons that we found role play to be really helpful is that people get a chance to feel what it's like to be the patient again and to sit in that seat in the experience. And I wanted to recognize what you were saying, Casey, to say that as institutions develop their fundamental skills workshop and their train-the-trainer process, they could look at opportunities to engage patient experts in many ways. So this is just the fundamental framework of how we typically begin, and each different program is nuanced a bit.
Right. And many institutions are using standardized patients, actors who are trained to give feedback to providers in a way that the providers can hear, so that there are many different ways for these role plays to occur. right, moving to phase 3. This is where we're turning back the curtain on the guy behind the controls. In the first day of the workshop, in the one-day course that we present, the people who are undergoing the Train the Trainer program are experiencing the workshop as they would if they were a participant in any one of these workshops. If they're going through the Train the Trainer program, on the second day, the first meeting after that workshop, this is where the future trainers start to understand what the magic is behind that day, why it was that workshop worked so well, and what makes that workshop different from all the other workshops that they've ever taken. It's not just that it's experiential. It's not just that they get forced to do role play. There is, as they learn the skills over the course of the day, there is inspiration that starts to happen, and an understanding that the things that the communication skills that are being taught really are applicable to their everyday lives. And how it's applicable is that we spend specific time talking about educational theory, not in depth, but just the fact that there are certain aspects of adult learning which are emphasized in the workshops that we teach that make the learning very, very effective, including the fact that we have providers bring in their own cases. We tend not to use pre-scripted role plays. We want providers to be in the space that they normally are, so that they can practice skills and bring them back immediately to the locations where they practice. They are also given a sense of the broad literature, which we gave you a very, very brief taste of at the very beginning of this webinar, where they can base all of their clinical skills, their communication skills, on that literature, and show that they're able to apply these communication skills toward better patient outcomes. And then the main part about practicing the workshop design is around delivery of didactics, continue to practice their fundamental skills, and then observation and feedback. So that's the portion of the Train the Trainer workshop where the future trainers are starting to understand what it takes to run a workshop. And then phase 4 is where they actually start to begin the mastery process of delivering the workshop. That is, starting to deliver didactics, starting to facilitate learning in role plays, and to observe the skills of people who are practicing and give them feedback. Mastery of anything requires both deliberate practice and feedback. This is material that comes from a psychologist in South Florida named Anders Ericsson, who has studied not just healthcare, but also sports and chess and music and many, many other different walks of skill building. And what he's found is that, you may have heard this from Malcolm Gladwell, it's that 10,000 hours of practice. That it's not enough just to sit there and say, oh, I understand that, I'm just going to go do it. One requires, in order to become a master, one requires that they practice toward a goal that they're going for, and then to get feedback toward that goal. For example, when I was a kid and I was learning how to play the piano, I was sitting in front of the piano for a couple of hours a day, at one point just practicing and practicing and practicing. But if I didn't go to see my piano teacher, who was both reinforcing the things that I was doing effectively and also telling me what things I should be doing differently, if I didn't have that touch in every so often, I would not have become, well, I don't think I was a masterful piano player, but at least I wouldn't have become as good as I was at the time. So really presenting those opportunities within the Train the Trainer program for iterative practice by the future trainers in order to improve both their communication skills, their fundamental communication skills, as well as their teaching skills, their facilitation skills. Both of those are worked on in this Train the Trainer program. The other aspects of this workshop, this phase of the Train the Trainer program, and this probably occurs over approximately 4 full days of training, is that there is increasing complexity in terms of the scenarios that are built for each of the future trainers. So each of the folks, they start out learning fundamental skills, very, very easy kinds of cases, and then the cases get harder, the facilitation challenges get harder, and it's building on, continuing to build on the skills that each of the future trainers is starting to get, so that by the end of these essentially 5 days of training, they can, quote, go live. And the last part of this phase of workshop delivery is where we have the future trainers actually practicing their didactic delivery and role-play facilitation skills with live participants. In part, they will be facilitating these skills with each other, along with some observation from, in our cases, an ACH expert. And then as soon as they pass that phase, then they're able to become independent trainers of facilitation, of communication and facilitation skills. I'm going to pass it back to Laura now. That's the training phase. This is the part of the training where each of the individual local future trainers is getting the skills to be able to run a workshop. Once the workshops are starting to run, however, there is further questions in terms of how you continue these programs over the long term.
Thanks, Calvin. And I often speak with people about how their institution can implement a program of this magnitude. And the phases that you just described in terms of an in-depth approach to preparing trainers, in many ways, once you get the ball rolling and you have expert support to prepare those trainers, that becomes the easy part. So many of you may be tasked with the opportunity to help ensure that those trainers and the program that they're delivering is viable and sustainable. It requires a lot of organization, leadership support, as well as some basic logistical support that can't be forgotten. So how will people register? How will participants be recruited? And at the front end, when we're in phase 1, how will those trainers be recruited? There are little details that can be big, which include things like reminders and getting rooms and refreshments ready, continuing education and applying for C&E, for example, and then providing that. And then a next phase of continuing education, what happens after participants engage in a workshop. One of the things that we like to think about as we look at phase 5, and even if we think back to phase 1, is really setting this up in terms of a change model. And one way to think about this is using a formal organizational change model. Cotter is known for an 8-step process for leading change. So we boiled it down to about 5 steps, and this is kind of adapted from what we've learned from studying Potter and how to really create change as you move into a more strategic mindset. This idea of creating a sense of urgency, this is really about getting people activated. And by people, I mean many layers of people, participants who will come through a future program as attendees. Before you get to that, there certainly needs to be a sense of urgency and importance among your leadership. There are tools to help you do that. When we talked earlier about building a case, many of you may be looking at patient experience reports or quality and safety reports, and those things can all be helpful to create the case. Looking at percentiles and rankings among local competitors or other institutions, helping internal providers understand where they sit in the quality spectrum in terms of their own scores, and the move towards transparency can really help with creating this. At many institutions, they're looking for ways to incentivize rather than punishing around this type of work so that people feel motivated and engaged, and that becomes a whole kind of communication messaging strategy to help build this sense of urgency. And then, of course, there are some financial implications, and by that I mean there's a sense of urgency for many of the institutions that we partner with that quality and patient experience metrics are directly impacting their reimbursement, and that can have a huge financial impact. And so it helps to build the case for investing in the time and resources needed. And when you think about that sense of urgency, you really have to move beyond recognizing, hey, we have a need, to recognizing that there must be a strategic plan. So it's easy for many of you to buy into the idea that communication is important, and that's probably why you're on this webinar for many of you. But the real nuts and bolts, I think, come into making sure you have a formal strategic plan in place, that you know who the players are in this work and who can contribute in what ways. And enlisting champions can mean a few different things. We've talked about the actual selection process for finding who your trainers, your facilitators will be. Those people certainly become champions. There are others that become champions along the way. It's important to have leaders who are well respected within your institution to help be a voice for this program. Those leaders need not be the trainers themselves, but they do need to be advocates in a sense, and in ensuring that others will essentially buy in and give the new program a chance. And that's part of what we're talking about when we say enabling action. We really have to remove some of the barriers that could be in the way with a program like this. Those can be philosophical, like people need to be convinced that this is worth it and important. They can be financial, such as finding protected time and ensuring that there's funding to support the program. And we usually like to recommend that to enable action, you should look for a few short-term wins. You have to bite a program off one piece at a time, and really start with a few workshops and engaging participants in those workshops that can help to build momentum in a positive way. So this enabling action can be part of what you consider as you form the strategic plan. And then, of course, sustaining growth is really important, and your strategic plan will help you think about that. But it's really much more than just starting a communication skills workshop. It really becomes part of a larger culture change effort in many cases, especially in the most successful cases. So your program will want to think about how to sustain the effort, what happens after a participant went through a fundamental workshop, what will continue to motivate and engage your new trainers as they carry this forward as your key champions. And what can you do to reinforce the skills and these behavioral expectations as you work towards creating change across your institution. And as we think about this creating change model, we're going to circle back to you and do a few survey questions again that may help you think about where you and your institution are. Calvin?
So this is a a revisit, maybe, of a prior survey question that you may have seen before, and we're wondering whether hearing some of this content has changed your idea about running a train-the-trainer program in your own institution. So reading it again, it is viable for my institution to do a train-the-trainer program for healthcare communication skills. Let's see whether there's any changes here.
And we invite you to say disagree or strongly disagree, because sometimes when people hear the phases of a program and the steps for change, it can feel quite intimidating. And as you continue to enter your responses to this question, I want to put out a word of encouragement to say that this can be complex, and any major change does take time and energy, and a big part of what ACH tries to do with our membership community is to give you support around that. So feel free to answer honestly here, and also to reach out as you think about the viability moving forward.
So I can already note that the strongly agrees have decreased a little bit. Mostly, many still agreeing, a couple of disagrees, which we welcome. It is not for the faint of heart institution to take on one of these programs, and the benefit of such a program, at least at the places where we have been, is and ends up being quite high. It is a fair amount of work to get there. The second question on this poll is, what phase of a train-the-trainer program do you think would be most challenging for your institution to implement? And we have phases 1 through 5, and I'll read through those phases. The first one is preparing the institution and selecting trainers. Phase 2 is participating in a fundamental communication skills workshop. The third one is understanding workshop design. The fourth is having the future trainers master the workshop delivery. And the fifth one is ensuring viability and sustainability. So all phases apparently are being represented here, which is great. It is absolutely normal that the ensuring viability and sustainability piece is the one that people worry about the most, so that's and so your responses definitely echo what is happening in the country at large. Thank you for your input. I think we are coming to the conclusion of our prepared part of the webinar right now, and so we are very, very open to hearing questions that you will be placing on the in the chat box, and seeing how much we can address some of those verbally.
Mm-hmm.
I think,
and we have a few questions, and some of those have surfaced as related to the content and some of the specific duration elements. So we're happy to follow up with some more details. Calvin put a note in there, and you're welcome to talk about that. Calvin, do you want to give just a very high-level overview about the skills?
Sure. There's also a question here about how long the training is, and so maybe I'll go through that a little bit as well.
Sure.
The three fundamental skills that we go over in the training that we offer, and it varies slightly between other institutions. The three fundamental skill sets. The first one is opening the encounter, so that would be introducing the provider introducing themselves to the patient, making certain that they are addressing barriers, understanding where the patient is coming from, eliciting a list of all of the patient's concerns and then setting the agenda for the visit. The second fundamental skill set is the relationship-centered communication skills piece, which is hearing with an open-ended question in depth what the patient's first concern is all about, eliciting the patient's perspective, understanding what their ideas and expectations are for the visit, responding with compassion, we use a PEARLS mnemonic, which is partnering with the patient, being empathic, acknowledging and apologizing for things the patient may have gone through, respect, legitimization, and support, and then transitioning to the biomedical or the doctor-centered part of the interview. So that's the second skill set. The third skill set focuses on the ending of the interview or the encounter, and that is really more about making certain that the provider and the patient have a mutual understanding of what the plan is, as opposed to the provider just downloading what their idea about what the patient should be doing is. So those are the three fundamental skill sets that we cover in our first one-day workshop.
Mm-hmm.
We also
Calvin,
place a yeah.
Sorry, go ahead.
We also place a fourth piece in that workshop, which is application of those skill sets to challenging scenarios that the participants bring. I hope that clarifies some of the communication skills that we cover.
Thank you. That was helpful, and again, happy to share more detailed resources with people who would like to know. And there was a question about timing. That fundamental workshop content that Calvin just described, we typically deliver that as an 8-hour workshop program, which is sometimes divided into 2 4-hour sessions. There are variances, and based on what your institution is doing, with or without support from ACH, you may have your own ways of going about that. But there is an evidence-based research that helps to show that for adult learning theory, that 8-hour timing is a critical learning point. So that might be another article that you'd be interested in seeing as a resource. And transitioning from that, I saw a question here from Kathy. What if organizations already have communication skills? So I'm not sure exactly what you mean by that, Kathy, but one thing I wanted to say about that is that your institution may already have adopted some type of communication skills program, and ACH invites institutional and individual members who are doing that work to be a part of our community and to learn from that. And so every case is different in terms of what type of support we offer to an institution or to an individual who may be doing that work. So Kathy, happy to talk about that more offline. And then I see that Laura Mortensen brought up the idea of staff resistance and burnout as barriers. Calvin, I wondered if you'd like to speak to that a little bit in terms of what you've experienced with helping to launch these training programs and how people can kind of get around some of those factors.
Well, burnout and resilience are high in people's minds nowadays in healthcare because the work that we do as providers is very, very challenging. And I would say it's not just about providers. I would say anybody in healthcare who comes across patients and the suffering that they experience, sometimes it can be very, very weighty. We know that by doing communication skills training, that there have been several studies that show that improving communication skills efficacy also decreases decreases provider sense of burnout. So just by going through these programs, it gives healthcare workers, clinicians, providers a sense of self-efficacy, gives them a sense of increased control, gives them a sense of increased openness to patients' experiences so that it's not it's less it weighs less on them. The ability to be compassionate in those encounters really also helps helps providers become more resilient. There is a caveat, however, and that is that if there is a lot of burnout, it takes a lot of doing to undo the burnout, and then to have the communication skills happen as well. So when Laura was emphasizing this viability and sustainability piece of phase 5 of the program, we're finding that institutions where providers have a sense of already have some self-efficacy do somewhat better than institutions where there are so many things going on, many new initiatives such as rolling out the electronic health record plus, doing quality improvement plus communication skills. Sometimes it just gets to be too much for providers, so it really requires that it requires a steady, thorough, and compassionate approach to all of the things that we want to do to make healthcare better, and also understanding what the provider's needs and what their capacity is. So it is. There's no easy answer here. Definitely, communication skills can help with burnout, but if it loads onto what's already full plates, then just like anything else, something that is well intended sometimes has negative consequences. I saw another question up earlier about team steps.
Yeah, the difference between I think the training that ACH provides, or fundamental training in relationship-centered communication to be more broad, and the type of training that Team Steps offers. Calvin, you've been trained and have trained in both pathways. I wonder if you might just have a word or two about that.
Right. So Team Steps, for those of you who don't know, is a method by which, or it's an approach that the Agency on Healthcare Research and Quality has put out, which really enhances the function of healthcare teams to more toward higher function. And one of the components that Team Steps mentions or mentions as very, very important in terms of team function is communication. Our training in relationship-centered communication, I think most folks who have some communication, most communication training programs focus mainly on the provider-patient communication dyad. There are definitely applications of these fundamental communication skills to teams as well. So the fundamental communication skills that I enumerated earlier work not only for patient-provider dyad relationships, they also work for patient and their family relationships with providers. They also work with healthcare members of the healthcare team. Team Steps really talks more specifically about streamlining ways in which teams can function with each other structurally. So the briefings, the huddles, the debriefs. Team Steps goes through more of the how communication should be done in terms of the pieces of communication that need to happen. Our communication training talks about specifically what skills in the communication, in the dyadic communication need to happen. I hope that's clear.
Laura, I'd like to point out, Kathy had a clarification about her question. I believe she was wanting to know if their organization already feels like they may have communication skills but don't recognize those deficits. Does AACH offer any type of support to help build a case, I assume is what she's looking for?
Yeah, I thank you, Rachel. I would say that yes, and unfortunately, most people, when asked, will rank themselves as effective in communication skills and rank their colleagues as less effective. And so part of this process is engaging people just enough that they will show up and participate. And part of what the train-the-trainer process does is prepares the facilitators for people who might come in with some resistance, thinking, I already know this stuff. I'm a great communicator. My patients love me. And facilitators are really well prepared to handle attitudes like that and to help support those individuals in recognizing areas where they might grow and to supportively pointing out during practice and feedback sessions ways that they actually do have learning opportunities. So Calvin, maybe you have a final word about that, and then we're going to move towards our conclusion.
I think you answered that very, very nicely. I think what the idea of train-the-trainer programs is mainly to increase the institutional buy-in to this very, very important aspect of healthcare, which until recently has been relatively de-emphasized. And so we're just very, very delighted that you are here on this webinar to think about how enhancing communication with patients and with team members can enhance the culture of individual institutions and thereby also enhance the culture of healthcare and increase the effectiveness of delivery of healthcare to all of us.
Thank you, Calvin. Great closing commentary. And I've just typed my personal email into the chat box for anyone that would like to continue the conversations. I really appreciate the typed discussion, and we wish we could actually hear your voice. So we hope we get a chance to meet you at our Enriched Summer course or at potentially at the fall ICCH meeting or continued conversation offline. Thank you so much. Rachel, I'll let you have the last word.
Sure. Yeah. Thank you both for leading such a great session today, and thank you everybody who joined us. Just as a reminder, if you would like to access the recording to today's webinar, AACH members can do so through the member portal. And if you would like to join us as an AACH member, there's the link again on the screen. And that is the conclusion of our webinar presentation today. I hope everybody has a wonderful day.